Hi, and welcome to Kidney Plugged In. February is Heart Health Month, and time to bring attention to the importance of cardiovascular health and what we can all do to reduce our risk of cardiovascular disease. But did you know that there is a direct correlation between heart disease and kidney disease? There's important information that we have for you to know, because if you have heart disease, you are at higher risk of kidney disease. And if you have kidney disease, this puts you at greater risk of heart disease. And then, in keeping in the spirit of Heart Health Month, our Come Cook With Us chefs, Dani and Anja, share with you a heart healthy cookie recipe that's simply delicious. And our Healthier You Fitness segment is back with personal trainer Ryan and his assistant Kim, and they show us a series of great heart healthy exercises. And the Director of Programs at the BC Yukon Branch, Chong, is here to talk about a wide variety of programs the Kidney Foundation offers to support kidney patients and their caregivers. From the comfort of the kidney suites to the fun at the kidney camp. And from the Living Donor Expense Reimbursement Program to the Living Donor Mentor Program, Kate shares important information on all of these programs and services. So please stay with us, because all of this and more is coming up next, right here on Kidney Plugged In. Welcome to Did You Know? Did you know that February is Heart Health Month? And did you know that there is a correlation between heart disease and kidney disease? You see, your heart and kidneys are two important organs in your body. They work together to keep you healthy. And when one is affected, the other one is too. In other words, your heart can affect the health of your kidneys, and your kidneys can affect the health of your heart. When you have heart disease, your heart may not pump blood in the right way. Your heart may become too full of blood, and this causes pressure to build up in the main vein connected to your kidneys. And this may lead to a blockage and reduced supply of oxygen-rich blood to the kidneys. And this can lead to kidney disease. Damaged kidneys may release too much of an enzyme called renin, which helps to control blood pressure. So this increase in renin increases the risk for heart attack, congestive heart failure, and stroke. In fact, kidney disease and heart disease share many of the same risk factors, including diabetes and high blood pressure. So please remember, having kidney disease can directly affect your chances of developing heart disease, and having heart disease can directly affect your chances of developing kidney disease. And now you know.
Hey, honey, I lost the list for Jason's birthday thing. Obviously, hamburger, cakes. No, not hamburger cakes. Hamburgers and cake. And buns, sausage.
Talking. Ooh, eye candy.
Is it a full moon tonight? People are being weird. And don't forget to make the Facebook event private this time. Okay, bye.
Can you imagine losing most of something without realizing it? Over time, kidney disease can destroy up to 80% of kidney function before you notice any symptoms. Talk to your family doctor to see if you're at risk and need to be screened. It could save your life.
Hello and welcome to Come Cook With Us. I'm Dani, dietitian, here with Anja, dietitian, and we're going to jump right in to our dessert, which is a walnut cookie. So let's get started, Anja. I'm excited to use some of these ingredients. The first ingredient I'm going to use is half a cup of canola oil. So this is a butter-free recipe. Now there's nothing wrong with butter, but canola oil does have that heart-healthy profile. So if you want to bake lots and eat lots of cookies, it's a good swap to do for butter when it's possible. So I've just got a half a cup of that, and then I've got some brown sugar. Again, it's 2/3 of a cup of brown sugar. If you're trying to balance your blood sugars, 2/3 of a cup is not a lot for the amount of cookies that we'll be making.
How many cookies are we getting out of this?
Oh, I don't know. My cookie scoop's gonna come out and play, and then we're gonna just have a feast. And what's so nice is everything's really easy. It's kind of like a one bowl moment, so I don't fuss, right? So I've got the egg in there, and then I'm just gonna put some vanilla extract. I really use more than a teaspoon, people, because it is so great for flavor. So I do love my vanilla extract. It is a pricey purchase, but it's worth it.
It's got good flavor balance in there.
Great flavor balance. I'm just going to blend all these together.
A fork?
I would love a fork. You know, I'm not fancy. A fork will do. Thank you so much.
A very forgiving recipe, because I know when I'm making baked goods, I'm always measuring everything and making sure I'm getting all the measurements correct.
Yep.
Tell me more about why this is so easy. I don't see any flour out here, hey?
I think exactly, because you're not worried about flour, and so you don't have to, you know, have an order to things. You can just kind of dump everything. So 3/4 of a cup of rolled oats. Instead of flour, how we're doing this to thicken this recipe is I'm going to use a little bit of ground flax here.
So that flaxseed is adding omega-3 fatty acids. Again, we're talking about heart health, heart month, heart eating. And it's also gonna add some fiber, good for your gut, help
Love
keep
it.
you full. And it adds that nutty flavor too. I like flaxseed for that as well.
This is such a beautiful smell too. These flax seeds are great, and it's a local, you know, it's kind of Canadiana, as I like to say. So I like to support Canadian goods. And so the carrot is going to be your sweetness factor and your texture, and same with the walnuts. So, you know, you could chop them with a knife and be really fancy, but I sort of do it the way my grandma did, which is just take it with your hands and just chop it up. So if you want, you can lend me a hand.
I can get it, yeah.
I like
Therapy.
I like this because it's therapy. And walnuts are a really great source of healthy oils as well. And so they give you a crunch, but they also give you that satiety factor or fullness factor. So, you know, it's a good kind of fat to add to your recipes and salads. And then all I do is just take my fork back and I just mix it all together till I've done a good job of incorporating it.
And what we want to show, so yes, we've made these cookies heart healthy by using canola oil, we've used the walnuts, we've used the flax seeds, and they're still a cookie. They do still have sugar, they do have the eggs, and they're still great to use for breakfast or snacks, or as Dani was saying, you can use them as your recovery snack as well. We do really want to say that all foods can fit and that desserts are still a part of your day. We like to make these so that we can use them as different times of the day, breakfast, lunch, snack, and not just as a dessert. How's it coming together?
So it's come together. Lastly, I'll add the flour. That's 3/4 of a cup. And that's gonna make a really nice dough. You can use gluten-free flour, you can use, you know, almond flour, you can use more ground flax.
You know, a trick that I've now learned as well with my kids and trying to increase iron levels is what I sometimes do in my baked goods, in my cookies and muffins, is I do 1/3 of a cup of baby cereal, and that's gonna give you a little bit of extra iron in there. So you swap out 1/3 of a cup of flour or gluten-free flour for 1/3 of a cup of baby cereal.
Oh, that's a great idea.
It works. Don't do too much more than that though, but it does change it a little bit.
Perfect. So I've got this really nice paste right now, which is great, which is what I want. And then I just use my trusted cookie scoop, and I just do a level scoop like that, and I just go. This is so efficient, easy, quick. No resting the dough, no kneading the dough. I mean, don't get me wrong, if you want to massage your food, that's cool. But today I'm in a rush, so I want to get it off and cooked and baked and ready to go as my dessert. It's a great breakfast cookie, and it's a great snack cookie. My kids love this cookie, my husband too. Like, my whole family really likes this recipe, and it's from the Diabetes Canada website. So hopefully you'll want to try it out and feel safe enjoying cookies. and knowing that you're getting lots of good nutrition and enjoyment out of them.
And so if I make, this looks like it's gonna make quite a few. If I make lots, do you freeze the dough? Do you freeze them once they're baked? What do you do?
They don't last that long.
Okay.
You know, they're gone. They're just gone. They're small, right? So another thing I like about using, you know, measurements when you're making things is you can control the size. And for me, the secret to a successful diet is portion control. If you have really a good handle on your portions, you can eat anything and everything and enjoy your food without worry or guilt. And that's kind of why we want to do this episode, because we want to just let you live your life a little bit and have fun and not always worry about the sugar content of everything. All right, can you pop those in the oven? So these cookies are fresh out of the oven, and no matter which way your cookie crumbles, I hope you'll try this dessert. Thank you so much for joining us on Come Cook With Us, and see you next time.
Explore the Kidney Wellness Hub today for more tips on building a healthier you at kidneywellnesshub.ca. Hope to see you there soon.
Leave me a message and I'll get back to you.
I can't believe it's been almost 20 years since we met. My whole life has changed. Whenever I felt alone, you were there for me. I guess what I'm trying to say is, I couldn't have done it without the Kidney Foundation. And now, I need you more than ever.
Excellent kidney health, optimal quality of life, and a cure for kidney disease. For nearly 60 years, this vision has guided the Kidney Foundation of Canada to be a collaborative, inventive, and focused leader, developing programs and services, providing research funding opportunities, and creating awareness campaigns. We've had a positive impact on millions of Canadians living with or at risk of developing kidney disease. The Kidney Foundation has a long-standing history of prioritizing, developing, and supporting Canadian and international efforts in kidney-related research. Canadian researchers can apply for research support through our yearly grant competitions, which support everything from capacity building for new trainees to basic biomedical research to clinical developments and allied health-focused projects. The Foundation values insight from those impacted by kidney disease, caregivers, partners, and researchers, and ensures that we continue to support and build a research portfolio that is reflective of community needs. The Kidney Foundation participates in and supports partnerships with other foundations and institutions in order to increase our ability to support targeted research areas and increase funding capacity. The Foundation's research program engages those with lived experience throughout the research process, aiming to maintain a patient-focused program which is representative of community priorities. At any given time, the Kidney Foundation can be providing support to over 400 researchers through research grants and partnerships at a large number of institutions across Canada. Within this research portfolio, the Crescent program is daring to boldly reinvent the future of kidney health research training. Collaboratively developed with the Canadian Society of Nephrology and the Canadian Institutes of Health Research, Institute for Nutrition, Metabolism, and Diabetes, the Crescent Early Career Training Program successfully enhances capacity while fostering collaboration and knowledge translation for the next generation of kidney health leaders. As one of the most mature health charities in Canada, the Kidney Foundation has always demonstrated that research is one of our top priorities. Our research program continues to strive for quantifiable change and an end to kidney disease in Canada. This continues to be made possible through the commitment of our researchers and clinicians and the dedication of those directly impacted by kidney disease, their caregivers, and our kidney community. The future of kidney research in Canada is bright. The Kidney Foundation provides much more than research funding and the hope it brings. The Kidney Foundation provides support and educational materials and builds communities so patients know they're not alone. Short-term financial assistance helps bridge gaps in resources when patients need emergency funds. Educational resources include comprehensive patient manuals and a multitude of brochures and fact sheets. Content is produced in partnership with renal and allied health professionals and distributed free of charge through renal units or directly to patients. Peer support gives patients someone to talk to who understands because of their own experience. Webinars and virtual patient forums have proven a popular and effective way to keep people up to date and connected in this unprecedented time. Kidney Community Kitchen aims to make food and cooking as easy and fun as possible for a population that has been told many foods are off limits. We are grateful for the many partners and funders who help us in supporting innovative research and providing crucial services, and we're proud of our ongoing collaborations. Our kidney community is strong. We're stronger because of the engagement and support from people like you. On behalf of those impacted by kidney disease, thank you.
What's up, everybody? This is Ryan of RD Fitness, and welcome to Healthier You, the segment where we give you tips, tricks, and advice on ways to live a healthier, happier lifestyle. Since February's focus is heart-healthy exercises, we thought what better way to celebrate than to give you a cardio-based workout that's going to get your heart pumping and blood flowing. Now, a lot of people, when they hear the word cardio, they automatically think running on a treadmill or using the elliptical. But cardio can be anything that induces your cardiovascular system. So what we've done today is group 4 of our favorite exercises together to give you a workout that you can do any place, anytime, and any fitness level can do it. So join us, but keep up, it's gonna go fast. The first of the 4 exercises we're gonna start with is one that we broke down last episode, and that's the squat. You're gonna start shoulder width apart, feet planted firmly, and you're gonna bring your hips back like you're sitting on a chair, taking a big breath in on the way down, exhaling on the way up. You want to keep your back straight, shoulders retracted. Perform about 15 to 20 reps depending on your fitness level. Again, if you feel lightheaded, take a break, go at your own pace. Next exercise we get into right after that is the reverse lunge. Almost identical to the squat, what you want to do is keep your weight on the heels and knees not tracking over the shoelaces. Take a big breath in on the way down and exhale on the way up. Again, 15 to 20 reps depending on how fit you are. You go at your own pace, you know your body. After the lunge, we're gonna get into a high plank position. Going down into the elbows, keep the chest and shoulders planted firmly, hips elevated to put any pressure off the back. And what you're gonna do is just step to the side, exhaling on each step, perfect. Keep the belly button sucked in so that you're keeping the core engaged, and just breathe out with every step. Again, we'll do about 20 repetitions of this, and again, feel it out. Where you feel comfortable. If you can do a little bit more, do a little bit more. If you need to take it back a notch, do a few less reps. The last exercise, but probably one of the most effective exercises, is the leg raise. Now, what you're gonna do is put your hands in the shape of a diamond underneath your butt. This is gonna take some of the pressure off your lower back. So you're gonna keep your legs straight, raising them up, lowering them down slowly, keeping the core contracted the whole way. Now this can be a little bit hard on the lower back. So one way to regress this is bring the knees into the hips and just roll the knees into the chest, pushing your hands into the mat as you bring your knees in. Exhaling on the way in, inhaling on the way down. And again, go at your own pace and listen to your body. Remember, it's not what you're doing, it's that you're exercising in general. Our goal is to help motivate you to get your body moving. This has been Ryan of RD Fitness with my beautiful wife Kim for another episode of Healthier You. Join us next time on Plugged In.
Save the date. Saturday, March 9th, 2024. That's the date of the much anticipated 12th Annual Kidney Gala taking place at the Paradox Hotel, Vancouver. Step into the 1960s glamour and celebrate 60 years of the Kidney Foundation of Canada. Every year, our community comes together to raise funds and awareness for kidney patients in BC and the Yukon, supporting innovative kidney health and transplant research. This year's gala will feature inspiring speakers, both silent and live auctions, an online raffle, and of course, delectable food and drinks. It's an evening you don't want to miss. And back again this year is our Grab and Go Restaurant Row gift card selection that will be online, available for viewing and bidding at the Kidney Gala website as of March 1st. You don't want to miss our carefully curated silent and live auctions featuring regional getaways, local experiences, fine art, and so much more. This is an evening of celebrating the glitz and the glamour of the 1960s, so you're going to want to be there. To purchase your tickets or find out more, please visit the website on your screen. We hope to see you there.
Hi, I'm Kate Chong, and this is Did You Know? Did you know that many people are unaware of the programs and services designed to support kidney patients and their caregivers here in British Columbia? Our short-term financial assistance program is in place to provide financial support to kidney patients at a time of crisis or when there has been an unexpected expense. The Kidney Foundation recognizes that many of the expenses associated with kidney disease are borne directly by patients and their families, and that often financial hardships is an additional stressor in their lives. Renal social workers may apply for grants for their low-income patients for unexpected household expenses, extraordinary travel, and other pressing needs. Any patient in BC or the Yukon who needs a kidney transplant must travel to Vancouver for transplant surgery and recovery. This usually entails remaining in Vancouver for about 2 months post-surgery. In order to support these patients, the BC Yukon Branch has established 7 kidney suites. These fully furnished units are free for 8 weeks for low-income patients and just $35 per night for those above the financial threshold. We have made sure to offer accommodation for a variety of demographics. There's a 3-bedroom townhouse for families, a child-friendly 2-bedroom near the St. Paul's Transplant Hospital, and even a suite that caters to the most senior population. Our branch offers a number of brochures and manuals that are available for free. Most popular are the Living with Reduced Kidney Function and Living with Kidney Failure, often distributed to kidney patients through the kidney care clinics. They are also available to individuals. Kidney patients and their caregivers can always call the Patient Services Department and chat with a staff member who can answer their kidney-related questions. Although staff are not providing medical advice, they are there to assist patients with questions about their kidney diagnosis, diet-related questions, to explain lab test results, and to direct callers to other appropriate resources. Kidney Connect is a telephone-based peer support program available to all kidney patients and their caregivers. People can request to be matched with the trained peer support to discuss a variety of topics from dialysis choices to lifestyle issues to concerns about being newly diagnosed. The Kidney Foundation supports organ donation. To this end, we provide a reimbursement program for anyone who decides to be a living donor, kidney donor, or liver donor. LODERP stands for Living Organ Donor Expense Reimbursement Program and aims to ensure that there is no financial barrier to being a living donor. Transplant social workers can provide more information and forms to candidates, or living donors can contact us directly. Another way that we support living donors is through our Living Donor Mentor Program. 13 trained supporters who have been living kidney donors themselves are standing by and waiting to talk to any potential living kidney donor who may have questions about the process. All demographics are covered as we've trained both women and men of all ages and geographical locations, some who have been anonymous donors, some who have donated to their children, parents, and some who've donated to a spouse of a friend. Each summer, the branch provides a summer camp opportunity for young kidney patients. All camp fees are covered by us, and children from all over BC and Yukon can enjoy a week of fun activities at Camp Latona on Gambier Island. We recognize the importance for children to spend time with others with similar kidney issues in a safe camp environment supported by nursing staff at BC Children's Hospital. Currently, the branch is offering 4 pilot initiatives that will be evaluated at the end of 2021 or mid-2022. We very much support patients who want to train to do home dialysis therapies and believe that there should be no financial burden to deter them. To this end, we offer the Northern Travel Pilot Program designed to cover accommodation and travel costs for those in Northern BC who need to travel to Prince George. All patients are eligible. There is no financial criteria. Similarly, we support kidney patients from Vancouver Island who need to travel to Nanaimo for home dialysis or peritoneal dialysis training by offering the Kidney Condo, a fully furnished 2-bedroom apartment close to the hospital. Again, there's no financial assessment for a stay here, and this residence is booked through a renal social worker. Many patients who are being assessed for a kidney transplant find themselves in a position where they may not move ahead with the process until they have a clean bill of health from their dentist. Unfortunately, some patients are unable to fulfill this requirement due to finances. We believe that no patient should be denied a transplant because they are low income. Consequently, we offer the Dental Pilot Initiative, whereby we will pay dentists directly for work done on qualifying kidney patients. And lastly, in collaboration with BC Renal, the Blood Pressure Monitor Initiative was developed. Any low-income patient who is affiliated with a kidney care clinic here in BC can access a free home blood pressure monitor, as the importance of home monitoring is recognized by all. We are here to help. Please reach out to us directly with any questions or speak to your social worker. And now you know.
Hi, I'm Chrissy Bennett here at the Kidney Foundation of Canada, BC Yukon Branch, and I'm looking for virtual volunteers to support our plugged-in online show on all things kidney related, including kidney health, kidney disease, and organ donation. You can find us on Shaw Multicultural, Shaw Direct, and Rogers West Television several times a week, or on our YouTube channel at Kidney Plugged In. Our content reaches into millions of homes. We need volunteers who are excited about all things video to help us grow our library of content. We want content from communities across BC and the Yukon, and we need videos in a variety of languages, including Cantonese, Mandarin, Punjabi, Korean, and French. If you're an active YouTuber, aspiring videographer, journalist, artist, actor, or speak another language other than English, we would love to have you join our team. You can volunteer a little or a lot. This role is built to fit your skills and time frame. To learn more about volunteering with the Plugged In program, contact me at volunteer.bcy@kidney.ca. I'm looking forward to hearing from you. You can find us on Shaw Multicultural, Shaw Direct, and Rogers West Television several times a week, or on our YouTube Plugged In. Shoot. I'm really looking forward to hearing from you. Oh, thank you. Thank you.
Thank you so much for joining us on Come Cook With Us. And whichever way your cookie crumbles, it's all good with us.
There you go. I like it.